following reasonable COVID precautions. We're really pleading with everybody in our community to become vaccinated. It will help us relieve the pressure from the unnecessary burden on our healthcare system. Vaccines right now are readily being offered at our Mercy Health Muskegon pharmacies, or at some of our MHPP offices and other retail pharmacies all over town. Masking, hand hygiene, physical distancing, we've talked about all of these things before on multiple different venues. They're still recommended, and they are important safety strategies to help keep yourself and others safe. Transitioning topics, I've also received some questions recently in regards to staffing at Mercy Health Muskegon, and due to many competing factors, we are experiencing a staffing shortage. This is just like nearly every other healthcare system in Michigan. To offset this, we've deployed strategies such as retaining multiple different contract labor staffing agencies to remain connected, as well as remaining connected with our partners in higher education to maintain a pipeline of new talent into our health system. The hospitals also offered retention incentives for current staff, recruitment incentives, and colleague referral incentives. Specific to our hospital, approximately 60 to 70% of our admissions of COVID-19 patients in our hospital are unvaccinated. It is important to note that nearly all of our ICU patients are unvaccinated, and essentially all of the deaths at our hospital have been in the unvaccinated population. It really does create an unfortunate burden on our health system, one that honestly would be easily eliminated with more widespread vaccination. And we continue to see this trend. We've seen it for a long time now, where vaccination, it works. It keeps people out of the hospital. Equally importantly, keeps them out of the ICU and prevents death. The safety of our patients, our colleagues, and the community really are our top priorities as we address these staffing challenges in our hospital and all of our facilities. As the COVID numbers tick up, we will not compromise safety or quality of care that our phenomenal staff are providing. So if we get back to the topic of vaccination, recently our parent company, Trinity Health, enacted a vaccine requirement for all of our colleagues, and our medical staff voted independently to require it of themselves. I'm happy to report that as of the current time, over 95% of Mercy Health Muskegon staff are fully compliant with the COVID-19 vaccine requirement. This is inclusive of those approved for medical and religious exemptions. I want to emphasize once again that the COVID-19 vaccination is not experimental. It has been well tested. It's been given billions of times around the world. It's fully approved by the FDA. We do encourage you to please visit our website, which has the most current information related to COVID. It answers many questions about COVID, and it offers scheduling for vaccines or testing. It all can be found on our website. Now it's my pleasure to welcome one of our fantastic local OBGYN physicians, Dr. Karissa Triska. We'll talk about vaccinations and how we implore everyone eligible to be vaccinated. Dr. Triska.
Thank you, Dr. Grill. Good morning, everybody. I'm Karissa Triska, and I am here to encourage every eligible member of our community to receive their COVID vaccination, including adolescents 12 years and older, women trying to conceive, those who are currently pregnant, and even those women who are breastfeeding. The CDC strongly recommends COVID-19 vaccination either before or during pregnancy because of the benefits of the vaccination outweigh known or potential risks. As of September 27th, more than 125,000 laboratory confirmed COVID cases have been reported in pregnant women, including more than 22,000 hospitalized cases and 161 deaths. The highest number of COVID-19 related deaths in pregnant women in a single month of the pandemic was reported in August of 2021. Approximately 97% of those pregnant women hospitalized with confirmed COVID infection were unvaccinated. This has been a very prevalent discussion in our community, and I want to make it very clear that the risks of contracting COVID-19 include an increased chance of preterm labor, preterm delivery, stillbirth, NICU and ICU admission, as well as death to the pregnant woman. These risks certainly outweigh any potential risks of the vaccination for those who are pregnant or trying to conceive. There was a recent study in the Journal of Obstetrics and Gynecology that showed the number of women who were pregnant and hospitalized for COVID-19 increased from 10% to 15% in late August and early September of 2021. This is more than double the percentages a year earlier. The medical director of the perinatal infectious diseases at Parkland Health System states that if pregnant women are exposed and infected, they run a higher risk of severe illness from the most recent Delta variant. Pregnant women should be immunized as soon as possible. The study consisted of 1,515 pregnant women who were diagnosed with COVID at Parkland between May of 2020 and September of 2021. Of the individuals included, 82 had critical or severe illness, including 10 on ventilators and 2 who had died. Of the 82 individuals, just 1 was vaccinated. The CDC, the American College of OB-GYNs, and the Society of Maternal Fetal Medicine, which are our high-risk specialists, strongly recommend that those who are pregnant or trying to conceive receive their COVID-19 vaccination as soon as possible. With more than 331 million doses administered in the US, the vaccines have proven safe and extremely effective against symptomatic infections, hospitalizations, and death. And again, pregnant women are considered in that high-risk population and a higher risk of being intubated and a higher risk of dying. We also need to stress that the vaccine does not increase risk of spontaneous abortion or miscarriage, and it does not impact or affect fertility or cause infertility. Women are afraid to get the vaccine, so we need to be confident in our discussion and explain that these don't affect those things such as miscarriage or fertility. The vaccines are so effective that today more than 99% of people who die from COVID-19 are unvaccinated. The science is clear, vaccines save lives. As of right now, only 22% of the pregnant population is vaccinated, and we must improve this. In pregnancy, there are at least 2 lives to save. So thanks for listening this morning, and I'm going to now pass it over to Dr. Kristen Woods, President of Mercy Health Physician Partners, to address where to best access care and wrap up this conversation. Thank you.
Thank you, Dr. Triska, and thank you for joining us this morning. As part of our integrated Mercy Health system, the medical group supports our community health in many ways. And as Gary stated, some patients in our community have delayed their preventive and chronic care with their primary care physician since the onset of the COVID pandemic. Taking part in regular screenings and routine preventative care and scheduling visits for minor acute issues help reduce healthcare costs by helping to prevent illnesses and chronic health conditions from spinning out of control, and they can help people stay out of the hospital and the emergency department. So your primary care physician should be your first contact for non-emergency health concerns. Mercy Health Physician Partners Primary Care offers a variety of services from annual wellness visits to vaccines and minor surgical procedures, and we can make specialty care referrals when needed. Nearly all of our sites are now capable to care for patients with upper respiratory illnesses once again. Previously, these had been deferred to urgent cares and what we called FURI sites or fever, upper respiratory infectious sites. But we've built the capacity to take care of all of our patients once again in our primary care offices. Mercy Health Physician Partner providers can be found in 46 locations, and we're growing throughout West Michigan. In an effort to address the limited access that we've been experiencing in our primary care offices, we've added 16 primary care providers to the Lakeshore just since January, and we continue to recruit for more. Just as the patients being treated in the emergency department and hospital have had more severe illness, so are those patients that we're treating in our primary and specialty offices. And we continue to also be challenged by the staffing shortages that Gary spoke to earlier. To better serve you, Mercy Health Physician Partners is open at various hours of the day and evening, and we offer after-hours care, online scheduling, MyChart video visits, and in some locations, we offer same-day appointments as well. We're working hard to be able to provide the access that you need to address the health concerns that you have today. We do have an ask of you as community members. We're pleading with everyone to get vaccinated and help us relieve the unnecessary strain on our healthcare system. Unvaccinated people continue to increase the risk of spreading the infection to our healthcare workers, both in the hospital and in the ambulatory offices, but also in the community at large. This burdens our health system in 2 ways. Unvaccinated COVID-positive patients require more intensive and longer stays in the hospital, and utilize more staff and resources, as Dr. Grill and Gary have outlined. And by exposing or infecting healthcare workers, we have fewer numbers of nurses, doctors, and support staff to care for those high patient volumes. The more adults and adolescents who are vaccinated also create protection for our children who are currently unable to be vaccinated and who are now experiencing an increasing number of infections and deaths from COVID. Please make sure to get your other annual vaccines as well, including the flu vaccine. And for those infants that meet criteria, their RSV vaccine too. Our second ask is to find a blood drive and donate your blood if your health and medical conditions allow this. There's a national blood shortage that is impacting us in West Michigan. Third, for non-emergency health issues, please contact your primary care provider first. You can do that easily online on our website or through your MyChart portal or through the phones. Please visit our website to learn where to seek appropriate care, when to go to the emergency department or urgent care versus your primary care provider. And finally, we ask that you be kind to those providing you service, whether it be in a healthcare setting, at the grocery store, in a restaurant, or at our schools. We're all doing the very best we can. And only through our solidarity will we successfully and safely navigate these current challenges. Again, thank you for your time today.
Thank you, Kristen. Appreciate that. I'm actually going to answer. There was a question in the chat we'd like to respond to, and the question was, can you provide more information about staffing and the number of open positions? So it fluctuates day to day, but between our medical group in Muskegon and the hospital in Muskegon, we have about 4,000 colleagues that work for Mercy Health Muskegon. And on any given day, we're in the ballpark of 500 open positions at any given time. So so a fairly large, significant number, pretty similar to health systems as a percentage of our total colleagues. But that's where we stand as of today.
Gary, there's another question there from Dan Booth at WGVU.
Let's see. Can you discuss the lack of nursing staff as nurses are getting paid a considerable amount of travel remote? Yeah, it's a good question, and it's a significant issue in the entire industry that there's a lot of nurses making the decision. Either it's nurses that are younger in age or potentially don't need benefits for one reason or other, decide to do travel nursing outside of their community, and there is a higher rate of pay for that. So what's happened in the industry is there's more travel nursing going on. So hospitals are, in essence, ended up requiring to use travel nursing because we're losing some nurses to travel agencies. So it is a dynamic in the industry that we're working on how to offset those things to make sure that we provide the environment where our nurses want to work here. We're providing retention and recruitment bonuses to keep our great nurses. But it is a dilemma in the industry, and there's no question it's impacting Mercy Health Muskegon as well.
And then John Mills has a follow-up on wait times.
Yes, what response do you offer to patients who have experienced that? I would just say, and I'll let Justin jump in, but as far as wait times, as Dr. Woods mentioned, some of the other opportunities in the community, but there's no question I continue to get very positive feedback about patients who are very ill coming into the ER. We do our best to triage and get patients back. There are some patients that have been triaged in the waiting room for a while, might wait a little longer, and just please have as much patience as you can. But we are watching and really triaging as best we can and getting our true emergency cases where they belong.
I think Gary hit that well. What we've really been trying to do, John, to answer your question, is explain to patients that this is really a state and nationwide issue. This isn't something that's confined to Muskegon County. I know when we live here and we work here, it feels like this is our entire world, but the truth of the matter is it isn't just Muskegon, and it's asking for grace for people to say healthcare as an industry nationwide is really struggling with this. and just asking for grace, saying, hey, our nurses and our physicians are working as hard as they can, maintaining quality of care, and we will do that as rapidly as we can. But it is a strain on the healthcare system right now, and we're seeing it in all of the health systems in West Michigan. I think actually, Gary, the next question is probably one for me to answer as well in regards to the length of stay. And is it due to COVID or is it due to something else? And the truth of the matter is it's a little bit of both. So COVID patients, generally speaking, have a longer length of stay than, let's say, a traditional pneumonia or influenza case that would be admitted to the hospital before COVID existed. So when those patients are admitted, they do stay longer. However, today, as we talk, our COVID population is maybe 15 or 20% of our inpatient population. So let's say 85% of our patient population is non-COVID. So clearly the majority of the increased length of stay is due to what Gary mentioned earlier in this press conference. And that's the people coming in at baseline are sicker than they were prior to COVID. And so that length of stay in non-COVID patients is much longer than what it was before. So it's a combination of both, to be honest, but the majority of the issue is actually non-COVID related medical acuity.
Yeah, that was a great answer, Dr. Grill. And really at any given time, the COVID population in our hospital isn't running only about 10% of the patients in the hospital. So it definitely is both. The next question was, what measures are you taking to retain your current staff so they don't leave the healthcare field? That is a great question. And I would say, we know that pay is not something that keeps people for the long haul. So what we're trying to do is work every day on the culture in the organization and the engagement of our colleagues. So every year we do a colleague engagement survey and get feedback for how the colleagues are feeling about the culture of the organization. And we're right in the process now of each of our department heads are doing deep dives with their departments into, because every department is a different dynamic. Every department leader is working on an action planning process, which is talking to the staff in their department. What are the things causing the pain points from a culture perspective and a process perspective, and trying to come up with unique plans in every floor on what to do. Burnout is certainly a big thing. Staffing is certainly a big thing right now. And each of our departments are working on specific strategies in their area to try to improve all those things. But culture is what we've got to continue to move forward, because we know that pay might keep someone for a short time. And we are doing retentions and recruitment bonuses and referral bonuses, all those kinds of things. But we know it's the culture of the organization that's going to take us forward. So that's kind of the focus of our department leads. The 500 open positions compared to pre-pandemic, no question that it's higher. I don't have a specific number, but there's no question the 500 open positions is significantly higher than it was pre-pandemic. So that's happening all over the country. As the previous question talked about, we're seeing people that are retiring a few years early that are in the healthcare field or trying different fields. There's no question the pandemic was it still is a difficult 18 months for folks that work in the healthcare environment. So we are definitely experiencing more open positions in healthcare, as is almost every business. Says, but can you speak to Muskegon residents about hospital capacity at Hackley is being removed? Is that creating the current issues? So I'll kind of summarize it a different way. If you think about the community of healthcare in Muskegon, we had Hackley Hospital and Mercy Hospital. Hackley Hospital had 4 floors of providing inpatient care, and Mercy had 4 floors providing inpatient care. I'm sorry, Hackley had 5 floors. But remember that when we did this consolidation, we're still using all 4 floors on the Mercy campus, and we added a 10-story tower to that campus. So we actually added the capacity. The reason we added a 10-story tower is so that we could provide private room setting for our patients. There's one exception. We added in our 3rd floor of the old Mercy Hospital, that still is providing semi-private care in times when we have a significant surge. And obviously, as everyone knows, this pandemic has caused a significant surge. So we have been using some semi-private capacity on the 3rd floor to help get us through the surge of the pandemic. But we did add the capacity to take on the additional volume that we're seeing, but it's very, very tight. We did add the beds we needed. We do expect that graph we showed that showed a 3.8 day length of stay up to 4.5. That's adding a floor of patients on every day. But we're working our best to try to get our patients through our system into the right setting of care post-discharge. And at the same time, we think that our length of stay over time will come back to a more normal length of stay. Hope that answered that question.
Gary, there was also a question or a comment that Jason Edwards offered. My sister is a nurse. She has not been offered a retention bonus. And I'll just comment and then turn it over to Justin on this. In the medical group, in the ambulatory offices, we've seen an influx of nurses that have wanted to leave the hospital and move into the ambulatory setting where the hours are limited to day shifts and Monday through Friday. So in the ambulatory setting to date, we have not offered a retention bonus, and I'm not sure where your sister, which area your sister works in. We are reevaluating and reassessing retention and recruitment bonuses in the medical group for nursing, but most importantly for us, the medical assistant staff. So Justin, I don't know if you have anything to add.
Sure. I mean, obviously in a public press conference, we really can't get into individual situations like this and what people are or not offered. There's a lot of detail that goes into individual personnel decisions that we can't share publicly. But Kristen is right. We have multiple different areas of the hospital and the medical group with different levels of need. But I can say beyond a doubt, we have offered retention bonuses. We have offered referral bonuses. We have and still are, I guess be saying with these, but offering staffing incentive pay that if people are picking up extra shift and working extra hours, there's pay incentives that come along with that here at the hospital. So we have a pretty comprehensive way to try to reward our staff who are here at the hospital.
Thank you, Justin. The only thing I would add to that is that we continue to look every day at, we started in some specialty areas where we had the biggest number of open positions, but we continue to expand that list of where we're going to be offering retention bonuses. So we continue to work through that every single day.
Looks like we have no other questions at this time.
Well, we very much appreciate the fact that this was an active press conference. And I would just say on behalf of Mercy Health and all of our presenters today, I want to thank you all for joining us and trying to help keep everyone in our community informed. And the more information you have, the better position we're all going to be in the community. So just want to encourage everyone to continue to follow public health guidance on wearing masks and getting vaccinated against COVID if you're eligible. So thank you, everyone, for being here, and be safe and be well.
Thank you.
Thank you.